Hi, everyone. My name's Kevin Watt. I am a professor of pediatrics in the Division of Pediatric Critical Care and the Division Chief of Pediatric Clinical Pharmacology. My research focuses on optimal dosing of drugs in children and other special populations. Specifically, I look at the impact of critical illness on drug levels in the body and how dosing might need to be adjusted. What makes my research relevant? I work with various populations who have rapidly changing physiology. As a result, this changing physiology can substantially alter drug levels and thus affect drug dosing. In fact, most of the drug dosing is probably not correct for these particular populations. For example, I work with critically ill children in the pediatric ICU, and they often have organ dysfunction that can impact drug absorption, drug clearance, and ultimately drug levels. Some of these children are also hooked up to devices like dialysis or ECMO, and those machines can also substantially impact drug levels. These are the sickest children that we take care of, and it's really critical for us to get the optimal dose. And that's what my research does. How does my research help the world? Well, a lot of what we do is determine optimal drug dosing in certain populations, such as critically ill children, and those dosing recommendations ultimately end up in places like the FDA label or in international dosing guidelines. And so the work that we do is really impacting things broadly at the international level. How has the CTSI helped me? The CTSI has been critical in a number of my endeavors. In particular, it funded a pilot project that was a collaboration with Hamid Gandhari and the College of Pharmacy, focused on optimal dosing of drugs in children on artificial life support. This study is developing data to optimize or to modify drugs in order to optimize dosing, and has recently been submitted for an R level award.